A 33-year-old para 2 plus 0 gravida 3 at 32 weeks gestation presents to the hospital with a 1-day history of vaginal bleeding, which is painless. She still reports of good fetal movements, and this patient has had 2 previous scars. On examination, you realize that there is bleeding that comes from the internal, cervical os, which is bright red, and it is painless. And then when you do the examination, there is no tenderness. What do you think this patient is suffering from? So hello and welcome back. My name is Joseph Tsuma, always your favorite doctor, and when you see me here, you know it is Matters Health. I'm here to bring you trusted health information that will be able to keep you and your family healthy. You can follow us for simple, updated, practical, and reliable medical insights to keep you and your family healthy, and you can subscribe to my YouTube channel at Doctor on Wheels. You can also follow me on TikTok at Dr. Tsuma. So today I want us to discuss placenta previa. But before we dive into today's topic, let's listen to some words of wisdom from the book of Exodus chapter 3 verse 15. And the Bible says, "And he said to him, if your presence will not go with me, do not bring us from here." And just a little bit of context here is God is having a conversation with Moses, and God was very angry because of the sins the children of Israelites has done. And he actually had promised to go with them to the promised land, but because of the sin, God was so much angry to a point of, he said that I am going to give you the promised land, but I'm not going with you. And Moses here is having a conversation with God that if you will not go with us, if your presence will not go with us, then there is no need of us actually leaving this place. There is no need of us leaving this place. And in as much as we can have all the things that we need, but actually the presence of God is heaven to us, and that is what we should always desire to have in our lives. So let us dive into today's topic. So what is placenta previa? So placenta previa is when the placenta implants in the lower uterine segment. Okay, now the uterus, okay, has the upper part, the middle part, and the lower part. Now the upper part is the bulkiest, where the placenta is supposed to implant, because that is where you have the bulkiness of the muscles, okay? And then the lower part basically is more, the muscles are not so much, so it's less muscular. Okay, so once it implants around the lower segment of the uterus, okay, now that is what is called placenta previa. Okay, now you can have placenta previa which is graded, so you can have grade 1 to grade 4. So you can have the placenta previa whereby the placenta has covered the whole of the internal os, or it has partially covered the internal os. And of note is that placenta previa is one of the major causes of painless 3rd trimester bleeding. Now, of note is that we say that we can have complete, partial, marginal, and a low-lying placenta. So placenta previa grade 1 is when you have just a low-lying placenta. Okay, placenta previa grade 2 is when the placenta just reaches the margin of the internal os, but it has not touched the internal os. And then placenta previa grade 3 is when the placenta has covered part of the internal os. And then placenta previa grade 4 is when the whole of the internal os has been covered by the placenta. Now, what are the risk factors for placenta previa? Number 1 is a previous history of placenta previa. Number 2 is previous cesarean sections, previous uterine surgery, so you've had a uterine surgery. And number 4 is multiple pregnancies. Number 5 is multiparity, so this person has given birth to very many children. Okay, number 5 is advanced in age. Number 6, history of smoking or use of cocaine. And number 7 is when you have had assisted reproductive procedures. Now, how do patients present? They will present with painless recurrent vaginal bleeding, which is bright red. Okay, mostly it takes place in the 3rd trimester or in the beginning or in the end of the 2nd trimester from around 28 weeks and above. Okay, and when you do the examination for the abdomen, okay, the uterus is non-tender, it is soft, and most of the time the fetal heart rate is present. Okay, and sometimes it's associated with malpresentation. Okay, but then when you do examination, there is no abdominal tenderness unless abruptio placenta basically end up coming into place. Now, how do you make a diagnosis? Of course, you need to take a good history and a good physical examination, okay? And your past you need to take a good past medical and surgical history. Is there a history of any uterine surgery? Do the person have either myomectomy or anything? So, good history and a good physical examination. But then diagnostic, the gold standard is transvaginal ultrasound. Now, the transvaginal ultrasound will be able to help you to locate the placenta, but also it will be able to help you rule out other differential diagnoses like abruptio placenta or even cervical lesions or cervical masses that can actually cause bleeding. Okay, and then the other thing is, of course, when the patients come in, you need to also do some other tests like full blood count, check their HB. You also need to do grouping and cross-matching to ensure that in case they are anemic because of the bleeding, you need to transfuse, and also you can do coagulation profile to be able to be certain that the bleeding is not caused by some coagulopathies. Now, what are some of the complications? Of course, we have the maternal and the fetal complications, and maternal complications include hemorrhage, and this hemorrhage can be so severe in such a way that it can actually cause maternal shock and actually maternal death. Okay, so that one in itself is antepartum hemorrhage, but also it poses a risk for postpartum hemorrhage. Once this mother delivers, they are at risk of actually developing postpartum hemorrhage. And then fetal complications include premature delivery, okay, or intrauterine growth restriction, malpresentation, and perinatal mortality. Now, how do you manage? When patients present to the hospital, the first thing is you need to be able to stabilize them because they are bleeding. So you need to ascertain the amount, okay, but then you need to stabilize them. You give them IV fluids depending on the severity, of course, of the bleeding, okay. You need to ascertain their hemodynamic status. If they have lost a lot of blood, you need to transfuse. Okay, the number 2 is you need to give drugs that can help to stop the bleeding, like tranexamic acid. Okay, and then the other thing is you need to avoid any form of vaginal examination, especially digital vaginal examination. You need to try as much as possible to avoid. You can do speculum, but then you also need to be very gentle. Okay, and the second thing is if the bleeding basically starts below 34 to 36 weeks, you need to give steroids, okay, corticosteroids, to be able to help with lung maturity, okay. And definitive management is basically delivery, and the delivery you want to do it at least, if the bleeding has not stopped, you need to do the delivery at around 37 weeks. But of course, when we talk about stabilization, it means then as well you need to give them some bed rest, okay? You need to stabilize them. They need to be hemodynamically stable, okay? And then, what is the mode of delivery? The mode of delivery, which is the most preferred, is of course cesarean section, okay? Especially for grade 3 and grade 4. For grade 1, probably you can try vaginal delivery, okay, and grade 2. But for grade 3 and grade 4, the recommended mode of delivery is cesarean section. Now, how do you prevent placenta previa? Number 1 is avoid unnecessary uterine surgeries, okay? And then number 2, you need to cancel these mothers who have had previous cesarean sections, okay? Okay, so you need to cancel them. The need for them to be able to do an early ultrasound to be able to detect exactly where the position, the exact position of the placenta. Now, if you have found this lecture very helpful, please consider subscribing to my YouTube channel. Consider following me as well on TikTok, and I will really, really appreciate. Until next time, God bless.